Hi, I'm Steve August. I'm a New Zealand physiotherapist. I've been treating bodies for about 30 years. I want to talk about pain ongoing after mastectomy and other breast operations. This is not something that, as a male physio, any woman has ever come to see me about. What's happened is that over the years I've treated other things, got the confidence, they've mentioned that, we've then had a look at it and it's sorted out very well. I think this whole area doesn't get well treated because people don't see it as a physical therapy or physiotherapy problem, and frequently it is. So what goes on is that for breast cancer, as you know, the breast has been removed. Now, the incidence of continuing pain after surgery, mastectomy or other surgery, including breast reduction surgery or even breast augmentation surgery, is that 20 to 50% of women will have pain ongoing or for a very long time after the operation. This is an appalling high number, and I think mostly they just get told, well, you sort of have to live with it. It's really scary for the women involved because every time they get a twinge, they think, help, it's the cancer coming back. Mostly this isn't the case, but as far as this video goes, if there's any suspicion of any recurrence of the cancer, then obviously, of course, you go to doctors first, you check that out. However, most of the ongoing pain after mastectomy is not to do with cancer because they've done a good job in cutting the whole thing out. What goes on after surgery is very straightforward, basic physiology and anatomy, and I don't find it difficult to treat. Please note, I'm talking about fairly limited, straightforward mastectomy and other breast surgery. So I'm not really talking about major complications with lymph glands taken out under the armpit, large neck glands taken out as well. This is the fairly straightforward stuff. So, but it is the commonest. Now, when you do a surgical operation for perfectly good, beneficial, therapeutic reasons, you're cutting down through skin and fascia and muscle, frequently heading fairly close towards the bone. That repairs, of course, and there's surgical repair as well, with stitches, as well as the normal tissue repair that goes on. Now, pain signals are carried through your body by mechanical receptors in overload, or what they call C fibers, free nerve endings in the skin and in other areas, including muscle, which can be triggered and cause pain. If I pull back my little finger as far as it'll go and then crank it back another couple of inches or 50 mils, I've got pain. It's not inflamed, it's mechanical pain. If I take the pressure off, it stops hurting. What happens with surgical scarring so frequently is that as the scarring repair after the operation happens, the scarring itself binds down and puts tension on the pain receptors and the nerves which carry the pain signals. So what you get so commonly, and I think this explains why there's such a high incidence of ongoing problems after the surgery, not just breast surgery incidentally, but after all surgery. The scarring takes place, normal repair process, but it binds down and makes hypersensitive these little nerve receptors and pain-carrying nerves. So, anytime in the future you're doing a movement or a lift or a strain that puts strain on those little fibers, they're already hypersensitized and they'll hurt. I want to give you an example. It was an old friend of mine. 20 years ago, Keith had his appendix out. Now, he kept getting pain for about the next 5 or 6 years on effort and straining and a whole lot of twisting. Now, unlike breast removal, we know that there's no problem internally. The appendix is out, he cannot have appendicitis again, so we know it's not that. This is, of course, not the case with mastectomy, and the reason I'm making this video is I really sympathise with the women who are getting these pains because it's scary. Every time you get a twinge, you think, oh help, it's the cancer coming back. So, in Keith's case, when he finally mentioned it, all I did was some massage on the scarring, loosened up the tight, tethered scarring fibres, didn't weaken the scar, not at all, but just made it a mobile scar, just through massage, and it cleared all the pain, I think, in less than a month. We did it a few times. That was 20 years ago, and he hasn't had a twinge since. I don't know, because I checked with him before making this video. So that's the principle, and it applies here as well. Now, you've got a lot of scarring where the breast has been removed. You can do most of this yourself, or you can go and find a good massage therapist. You need someone who's reasonable. To be perfectly honest, my take would be you need someone who's getting enough oomph to actually do an effective stretch on the tight scarring, not weakening it, but just loosening it, by which I mean making it more mobile, not making it weaker, but essentially getting the sliding surfaces of the muscle and the fascia and the skin back to sliding past each other, so there isn't this binding, tugging on the nerve endings, and therefore pain. You can do most of this yourself. If you stretch out the pec muscles through here, just by putting your arm back like that, you can work around, lying on your back, you can work around this whole area with your own fingers with massage. In a lot of ways you're best to do it because you can feel where the tight bits are. Obviously, you start gently. You put anything on your fingers to let the fingers slide. This can be massage wax, which is ideal, or cooking oil, olive oil, even talcum powder, body care lotion, just anything to let the fingers slide. So it's a little bit like having tight buttery bits in pastry or scondo, and you work them around till they loosen up. Do this about once a week, and do it quietly to start with, maybe about 20 minutes at a time. You do need to let things settle down afterwards, and you do need to go quietly. By the time you've been working in through here for a few minutes, it will be getting looser anyway, and it will be starting to feel a bit easier. But it may definitely feel tender to touch for the next few days. That's not a problem, it's just part and parcel of breaking down the scarring and getting everything moving. You can also stretch the pec muscle, which is an ongoing thing anyway. The simplest way is just leaning back. You can put your hand on a wall and stretch forward, or you can lie on a table and drop the arm down over the side of the table or over the side of the bed. Holding that stretch for about 30 seconds, doing a few of those. But stretching will only take you so far. It doesn't have as much leverage on scarring as actually getting in with your fingers does. So you work in all directions because the fibres run in all directions, mostly this way along the line of the pectoralis muscle, but it's just working everywhere around here. Now, the other component that goes on is that in most of the women that I see, this is all it took to clear the ongoing pain here that they were continuing to get. On quite a few of them, we also found that the ribs, which attach to the breastbone underneath the pectoralis muscles, underneath where the breast was, had also frozen up. This isn't too surprising when this has been gummed up with scarring for years, and the moving rib machinery underneath that also stiffens down. In this case, all we did was loosen up the tight rib hinges around the back. There is a New Zealand device that we find ideal for this, which you can use at home. It's called the Backpod. You can lie back on it and has enough leverage to actually stretch those tight rib hinges. We can't really seem to find anything else that is as good as this. This is covered in another video of mine called How to Fix Most Costochondritis and Tsetse Syndrome Chest Pain. Have a look at that one. There's a part 2 version as well. And it tells you about this rib component. Not all of you will need that, but it's pretty common, and possibly most of you will if it's over a year since you've had the breast off. Now, I hope this is useful. I'm wanting to pass it back because it seems to be something that not many people want to talk about, and not many people want to talk about in a really effective, practical fashion. I do find this is a physiotherapy problem once anything dire, like the cancer coming back, has been excluded by checking it out medically. But mostly that's not the case. And it's a very logical reason for the pain, and you can treat it logically in a simple way yourself. The best of luck with that. I do hope this helps. Thank you.